I'm Pauline Osborne. I'm with Moving to Heal, and I'm here today with Dr. David Musnick.
I'm a sports medicine doctor and a functional medicine doctor, and the reason why I have equipment is because I realize that a lot of times things in the body actually need external healing. In other words, they need something applied to them to help them heal.
Yeah.
Because sometimes things that are going on, like a tendinopathy, which is a chronic tendinitis or a partial tear, or a joint inflammation, sometimes they just won't heal. Or arthritis, osteoarthritis won't heal. So I've been for a long time looking into equipment, we call them modalities, that will help tissues heal. So right here I have something called frequency-specific microcurrents.
I'm going to move this a little bit.
Yeah, and there's different boxes here, like these are little computerized boxes that they're like microcurrent computers, and they're different from different companies. But anyway, so what we have here is we can set the A and the B channel. The A channel is the condition, like inflammation or congestion, and the B channel is the tissue. So I can treat like literally virtually every tissue in the body, tendons, muscles, nerves, joints, and treat them to the different conditions. And the nice thing about these little boxes is they're computerized, so they can have a whole program that could run. So it would be applied through these strips that get put around a moist towel that get put over an area. So let's say we're treating the neck.
Yeah.
So this would be, one would go behind the neck, one would go in front with a moist towel. And the nice thing is that these don't hurt or have any side effects, and it can decrease inflammation in the neck. This type of device is my go-to it for a lot of things because it helps everything decrease inflammation, decrease pain, improve cellular health. It can decrease the inflammation of a joint that's really inflamed in the spine. It's great for trigger points. You can treat trigger points that won't respond to massage. It's really great for tendinitis. It's good for rotator cuff problems or rotator cuff tears. It's good for nerve problems. So, and believe it or not, you can actually treat the brain after a concussion with this, which is pretty neat. So this is called frequency-specific microcurrent.
Okay. And you used that with my husband. My husband had come and seen you.
Yeah.
And my husband's like the physicist. He's like the science guy, and he appreciated the fact that he found it beneficial and it didn't seem woo-woo. It was kind of grounded in science.
Yeah.
And he really appreciated.
There's actually a textbook written on it. Like
yeah.
in my office, I have a textbook. So there's actually 2 books written on frequency-specific microcurrent, and there's at least now 11 research studies on it. So it's of almost any type of microcurrent, this is the best researched. That's why it's called frequency-specific microcurrent. So that's one of the reasons I like it. Plus, it requires a lot of training, like hundreds of hours of training, and I actually help give lectures in the advanced courses. I go to meetings every year and keep up with it. So
awesome.
Yeah.
And then the other equipment here.
So I have a laser from Sweden, and this is pretty cool. If you zoom in on this, it's www.radia.se. SE stands for Sweden. How often do you see .se, right?
Not very often.
Cool? Well, Sweden is actually a place where a lot of the laser research was done.
Yeah.
And this particular company, Aradia, makes really good lasers. I'd say there's 2 top laser companies: Thor, Thor, like the movie, and Aradia.
Okay.
And I have the Aradia. And the reason I like this is it's a super pulse laser, 4 laser heads, and it helps decrease pain and it helps healing at the same time. And so lasers are different than microcurrent because this is actually light coming out of here.
Okay.
And there's 2 types of light that will come out of here, and I'll turn it on. So don't look at it directly, but there's 2 types of light that can come out of here. Okay. So there's regular light coming out, red light, but then there's infrared light coming out from these that you can't really see very well. Okay, so, and I just turned it off, but there's 2 types of light coming out of here, but primarily we're treating the infrared light.
Okay.
And people are familiar with little lasers, the laser pointers, but those are so weak, and they're not infrared. They don't penetrate very deep at all. But this can penetrate up to 5 centimeters. It can be used for carpal tunnel. It can be used for nerve problems in the neck. It can be used on a painful tendon. The nice thing is it works very rapidly. Doesn't hurt. It's a cold laser, so it doesn't burn anything.
Okay.
And I kind of call it sometimes like my spot welder. Like, I can put it places where people hurt. The microcurrent's nice because you don't have to put that on places exactly where they hurt. It can stream through the area. But this you want to put on direct contact with people hurt. Like if someone had a bone bruise, you put it right on the bone. And you have to put it right on the skin. So that's that one. And then I have a pulse magnetic field device in the other room. I forgot to bring it in, but it's about this big, and we use that for arthritis conditions, especially of the knees. I do have something pretty cool here, which is called an AVE, which is audio visual entrainment.
I like how it says David on there.
It does, actually, but this is an abbreviation. I didn't make this. So anyway, these glasses get hooked up into this, and these headphones get hooked up into this, and this can actually modulate brain waves. So it can decrease anxiety, decrease stress. It can improve concentration. It can improve mood if someone's depressed. So I use this a lot for people with head injuries, or people with ADD, or people just with anxiety and depression that want to feel better.
And it's a lot of my client, student, and base. So it's very, very needed, especially right now. It feels like there's a lot of people struggling more with anxiety.
Yeah.
So
I mean,
that's awesome.
This is an adjunct,
Yeah.
because I might use diet supplements and exercise for anxiety, but anyway, these are the main tools for the musculoskeletal system, along with the PEMF unit that I have in the other room.
Thank you for letting me come to your office and
You
showing
are
the
welcome.
equipment.
Thank you for being such a good NIA teacher.